Mrs. Jones. I'm Skyler. I'm going to be your nurse today. Before I start, I'm going to go ahead and perform hand hygiene for 20 seconds. I'm also going to go ahead and look at your wristband. So can you please state your name and date of birth for me? April Jones, February 4th, 1983. Is that you? Alright, perfect. That matches my records. And I also noticed you don't have an allergy bracelet. So I just wanted to ask if you have any allergies. No allergies? Alright, perfect. I'm going to finish washing my hands for 20 seconds. Alright. Now that I finished washing my hands, I'm going to go ahead and explain to you what we're going to do today. So we're going to actually insert a Foley catheter today, and are you aware of that? You are? And the doctor said because you were having urinary retention? Yeah? Okay. So basically, we're in this procedure, we're going to go ahead and expose your genital area. We're going to go ahead and wipe your genitals with some perineal wipes, and then we're going to go ahead and insert a Foley catheter into your urethra and into your urinary bladder. And then we're going to go ahead and inflate a balloon in there to keep it in place, and we're also going to put a stat lock onto your anterior thigh, on the top of your thigh, so we can secure the catheter more, okay? Are you experiencing any pain right now? No? Yeah? Okay. That's probably because of your urinary retention, and you do have some abdominal distension right now, so that's probably why. And we're going to put this Foley so we can actually relieve that pressure in your abdomen, okay? Do you have any questions or concerns for me before I proceed? No? Well, actually, in this procedure, it's not very painful, but it will cause some discomfort for you, okay? So I just want you to be aware of that. Any more questions? No? Okay. I'm going to go ahead and perform hand hygiene for 20 seconds, and then we're going to go ahead and put on some clean gloves. And then we're going to go ahead and wipe down our table for 30 seconds. So I'm going to grab a wipe, and I'm going to wipe down the table for 30 seconds. Make sure it's nice and clean. Now we're going to wipe the edges. Alright, now that we wiped down the table, I'm going to go ahead and throw that away and remove these gloves. Perform hand hygiene for 20 seconds. I'll let this air dry for 2 minutes. And then I'll leave Mrs. Jones flat on the bed. Are you okay laying flat, Mrs. Jones? You are? Okay, perfect. I'm going to go ahead and pull the privacy curtain up to maintain privacy. Okay, Mrs. Jones, now that I let this air dry for 2 minutes, I'm going to get the supplies, and then we're going to go ahead and wipe your genital area with some perineal wipes, okay? So I'm going to perform hand hygiene for 20 seconds. Grab my supplies and put them onto this table that I just cleaned. So we have some perineal wipes, a 10 milliliter sterile syringe, an alcohol sterile prep pad, and a stat lock as well, and also a Foley catheterization tray. So right now, we're going to just wipe you. So we're going to get that. I'll perform hand hygiene for 20 seconds and put on some clean gloves. Okay, Mrs. Jones, now we're going to go ahead and expose you, okay? I'm going to pull the sheets down and pull your gown up, okay? So I'm going to go ahead and pull the sheets down. Alright. Expose you a little bit, okay? I'm going to pull this up, okay? Just to show that, okay? Now I'm going to grab a warm blanket, just to keep you warm, okay? I'm going to go ahead and grab your knee here, lift it up, and put it in a froggy-like position, as so. Okay. Now that we have that in position, we're going to go ahead and open this perineal wipe up. I'm going to hold your labia and spread it. And then from one side, top to bottom, I will wipe. Throw that away. Grab another one. On the other side, I will wipe from top to bottom and throw that away. Now one more in the middle, from top to bottom, and throw this away. Alright, Mrs. Jones, we're done wiping. I'm going to go ahead and expose you for a bit just so I can prepare my tray, okay? Because we're going to insert the catheter now. So I'm going to go ahead and remove my gloves, perform hand hygiene for 20 seconds. Alright, Mrs. Jones, I'm going to prepare the tray now. So I'm going to go ahead and grab the tray, throw these packagings into the trash, go ahead and set up my sterile field now. As so. And grab this carefully, put that, and turn this around a bit, making sure I maintain sterility, aseptic, like that. And then I'll grab these sterile gloves, put them right there. I'll grab the sterile drape, touching the 1-inch borders, and then shiny side down, and place it into here. No touch technique. We're going to go ahead and grab this drape and toss this because we don't need it. Now I'm just going to carefully move this to the side a bit, just so I have some space to put on some of my gloves. We're going to drop in our stat lock into our sterile field, like that. Throw this away. We're going to drop our 10 milliliter sterile syringe into place. Perfect. I'm going to toss this away. And then we're going to go ahead and get my alcohol sterile prep pad and toss this one into place as well. Alright. Toss that away. Now I'm going to perform hand hygiene for 20 seconds. And now I'm going to put on my sterile gloves. Carefully open this up. First, nice and open. Okay, we're going to grab one glove. And then we're going to put one on, like so, and then we'll grab another glove. Put the other one on. And then we're going to go ahead and release this cuff, like so, and then release this cuff, like so. And we're going to go ahead and toss that away. Now that we're maintaining sterile, we can grab these and set up our supplies. Carefully grab this and move our stuff around so just we have more room. I'm going to go ahead and tear up this. Hold on, let's move this over there. I'm going to tear the swab stick open. I'm going to grab our sterile saline. We're going to grab our lube as well. And I'll toss this away because we don't need it. We're just going to put our lube in here for now and our sterile saline here. Going to pull out some of the swab sticks a bit, just so we have easy access to them. And just set them in here. I'll grab our urine specimen cup, container I mean, and open it up. And then we'll just go ahead and just leave it on this side over there, just so it's open and ready. Then we're going to go ahead and open our sterile saline that we're going to use to inflate the balloon. We're going to go ahead and put that on here, like so. Then we'll just leave it in here. Then I'll go ahead and open the loop, removing this, tossing it away. Then we're going to carefully grab our catheter, like so, and just carefully going it up, make sure it doesn't fall. Toss that away and then put it into the loop. As we put it into the loop, I'll put it back into the box, set that up. Alright, now we're going to go ahead, knock this one over, and put that up. Now we're going to go ahead and transfer it over to our other sterile field right here. Okay, Mrs. Jones, now we're going to go ahead and wipe you with the swabs, okay? So I'm going to go ahead and touch this with my non-dominant hand, spread the labia, grab one of the swab sticks and wipe from one side, from top to bottom on that. Grab another one on the other side, top to bottom. I'm going to throw that away. And then in the middle, I'm going to grab one swab stick and grab it. Okay, in the middle, top to bottom. Throw that away. We're just going to grab this from the side and throw that away as well. Okay, Mrs. Jones, now we're going to go ahead and actually insert the urinary catheter, okay? So I want you to take a deep breath in, and then on the count of 3, I want you to exhale, okay? So deep breath in, exhale, and then I'll count 1, 2, 3. Okay, 2, and I got a urine flash. Go ahead and insert 1 to 2 inches further. All right, perfect. I'm gonna go ahead and grab this, holding the catheter here, and now I'm gonna inflate the balloon with this hand, like so, all the way. And then I'll remove that, toss this away. Then I'm gonna gently pull, just so I meet resistance, which is perfect right there. Now I'm gonna go ahead and collect our urine specimen. So I'm gonna go ahead and grab this right here, and grab our sterile wipe and scrub the hub here for 5 seconds. 1, 2, 3, 4, 5. Throw that away. And then we're going to go ahead and grab our 10 milliliter syringe and put this into the hub that I just wiped. Put it in. Okay, and then we're going to drop 5 milliliters of urine. Like so. I'm going to remove this. We're just going to set it into our sterile field for now. Okay, and we're going to toss this lube away. We don't need it. Okay, Mrs. Jones, I'm going to go ahead and put your knees back into place. Your legs in a nice position there. Now we're going to go ahead and actually use a prep pad to wipe your anterior thigh, which is where we're going to place your stat lock. Throw that away. Now I'm going to make sure this arrow is pointing upwards, and then we'll just place this like so. Make sure it's like that. Arrow pointing up, clip it, and then we're going to remove this. Just going to remove this so we can stick it to the patient onto the anterior thigh where I just prepared. All right, throw that away. Then we're going to grab this bag. Going to go ahead and hang it underneath the bladder because we're going to let gravity do the work for us. So I'm going to go ahead and grab this, throw it away, and then we're going to go ahead and put your knees back again just to make sure. We're going to cover you up now. You want your warm blanket still, Mrs. Jones? Yeah? All right, I'll keep it on then. I'll go ahead and cover you now. And it looks like your urine is coming out. We have around 500 milliliters of yellow clear urine, which is good. You feeling okay, Mrs. Jones? All right, perfect. We're almost done. I'm going to go ahead and remove these gloves now. I'm going to go ahead and perform hand hygiene for 20 seconds. Then we're going to put on some clean gloves. All right. Another clean gloves. And then I'll carefully grab our sample here into the container. Make sure it doesn't splash. Perfect. We're going to toss this into the trash. We're going to go ahead and close this container. And then I'm going to go ahead and write the patient's name, MRN number, and date and time of collection. You can set that aside. I'm going to throw this away. Okay, Mrs. Jones, now that I have your urine sample and everything's good, are you feeling okay? Yeah? Okay. So now I'm going to go ahead and raise your head up. I'm going to go ahead and also document my things that I need to document, which is the urine sample collection, as well as the date and time of the procedure, your tolerance, which you tolerated well, the length of the catheter, and also the description of the urine and amount of urine, which was yellow clear and around 500 milliliters were in the bag right now. Okay? I'm going to remove these gloves, perform hand hygiene for 20 seconds. And do you have any questions for me? No? I'll make sure your call light is in reach. And your bed is in the lowest position. Okay, Mrs. Jones, I'll go ahead out now, okay? Bye-bye. Hello, Mrs. Jones. I'm Skyler. I'm going to be your nurse today. Before I start, I'm going to perform hand hygiene for 20 seconds. And I'll go ahead and look at your wristband. Can you please state your name and date of birth for me? April Jones. And date of birth is January 4th, 1983. Is that you? Yeah, that's you. Okay. Do you have any allergies? No allergies? Okay. So today we're basically just going to go ahead and remove your catheter that was placed in your bladder. And have you ever had your urinary catheter removed before? No? Yeah, so basically we're going to go ahead and deflate the balloon that's in your bladder. And then we're going to go ahead and remove your catheter carefully. And it should be quick and it shouldn't cause any pain for you, okay? Are you experiencing any pain right now? No pain? Okay. Do you have any questions or concerns before I proceed? So I'm going to actually go ahead and reveal your genitalia again just for a little bit. So I just want you to be aware of that, okay? No questions? Alright, I'll go ahead and start then. So I'll perform hand hygiene for 20 seconds. Put on my clean gloves because this is a clean procedure. Alright. And then I'm going to go ahead and close the door and close the privacy curtain to maintain privacy. I'm also going to lower the patient down to a supine position. Are you okay, Mrs. Jones? You're okay? Alright. I'm going to go ahead and reveal you now, okay? So I'm going to pull down your sheets. Like so. And then I'm going to go ahead and pull up your gown just to show your genital area. And I'm going to assist you in a froggy position. As such. Like that. On your knees. And now I'm going to go ahead and put the chucks on you so we can prevent some urine, some splashing. And then I'm going to go ahead and open this 10 milliliter syringe so we can remove the balloon. I'm going to remove this from the lock right here. As such. Now we're going to go ahead and remove the saline that's here. And we're going to go all the way up like so. And remove it, and then toss some saline into the trash, and then we're going to go ahead and deflate it again, like so. And then we're going to toss this into the trash. Okay, Mrs. Jones, so now we're going to go ahead and actually remove your catheter, okay? So I want you to take a deep breath in, and then deep breath out. On the count of 3, I will remove it, okay? So deep breath in, and deep breath out. 1, 2, 3. Alright, and now we're just going to cover it up in this chuck so that urine doesn't splash anywhere. Then we're going to go ahead and lift this and put this on the table for now. And then I'm going to go ahead and assist your feet back to normal position, and I'll just cover this up because we're done with that. Feeling okay, Mrs. Jones? Okay. So you didn't have any difficulty or resistance pulling out the catheter, but if you did have some difficulty removing the catheter, I will go ahead and try to deflate the balloon again, putting the syringe there and deflating it. And if that doesn't work and there's still resistance, I'll go ahead and actually call the doctor, and I won't forcefully remove the catheter from you. Other than that, that should be good. I'm going to go ahead and actually remove this lock on you. And I would use alcohol, but it might cause you to sting, so I'm just going to go ahead and carefully remove it from your skin here, okay? Just holding down the skin and pulling away, like so. And then I'll go ahead and throw this away. Do you feel okay, Mrs. Jones? Okay. Go ahead and cover you up now. Alright. And then raise your head up and put your collet in reach. I'm going to put this into a graduated cylinder, measure the urine from this bag, and also note down the description of the urine. And once I do that, I'm going to go ahead and toss this away into an appropriate receptacle. Okay, Mrs. Jones, we're basically done removing the catheter, but I just want to provide some education for you. So, your next 1 to 2 voids, I actually want you to use the call light and call me when you're voiding so that we can actually measure your urine output and the amount, or like the effectiveness of your bladder emptying, okay? And I also want to document or note down and tell you that this might cause a burning sensation when you first urinate, and that will actually die down from your next frequent urinations. And I actually want you to call a nurse or me or use your call light if you're experiencing trouble urinating and also pain and also if you have blood in your urine. So I want you to call me for that too, okay? And then other than that, you should be fine. So I have your call light raised and your bed is in the right position. So now we're going to remove these gloves, perform hand hygiene for 20 seconds, and then once I exit, I'm going to go ahead and document the date and time of the procedure, the patient's tolerance of the procedure, which you tolerated well, and also the amount of urine and the description of urine in both the Foley catheter bag and also your next 1 to 2 voids. That's it.